Thanks for connecting to this virtual poster presentation and discussion with a recent AMCP Foundation Best Poster Awardee. I'm glad to be joined today by Shelby Chan, who was the Best Student Poster Awardee at the most recent AMCP meeting in 2024. Next slide, please. The AMCP Foundation Best Poster Competition is hosted at AMCP meetings in the fall and the spring. And we want to thank our sponsor, RTS Solutions, for their generous support of the competition. Next slide, please. I'm your moderator today, Jeff Heater, Director of Pharmacy at Blue Cross Blue Shield, Nebraska, and in the AMCP Foundation Joint Research Committee member. Next slide. So a little bit more about the Joint Research Committee, or JRC for short. Our committee objective is to promote and encourage creation and dissemination of credible and relevant research and initiatives that advance patient care services within the managed care pharmacy community, as well as improve healthcare for all. And this is done through three initiatives. The first, to develop and update research agenda, which identifies and prioritizes critical evidentiary gaps within managed care pharmacy. And second to that is to disseminate then that research agenda to evidence generators, funding bodies, as well as others that can advocate for the undertaking of research initiatives and to address the identified evidentiary gaps. And finally, cultivate student and practitioner interest in conducting and taking part in clinical or in research. Next slide, please. So we do this through four pillars that support the research agenda for managed care pharmacy. The first one is real-world evidence that is used to inform managed care pharmacy decision-making. The second pillar focuses on value-based models within managed care pharmacy and how does that address the total cost of care. The third pillar, impact of benefit design and/or utilization management and the strategies within those and their effect and impact on patient outcomes. And then finally, the fourth pillar, the impact of direct patient care services that are provided by those in managed care pharmacy and their impact on patient outcomes. Next slide, please. So again, it's my privilege and honor to introduce everyone to Shelby Chan, who is the Best Poster Award winner for Best Student Poster at AMCP Nexus 2024. Shelby, welcome and take us through your research.
Thank you, Jeff. Hi, everyone. My name is Shelby. I am a current P4 attending the University at Buffalo School of Pharmacy and Pharmaceutical Science. My research is on a cost-benefit analysis of social determinant of health programs within a clinical integrated network of community pharmacy. Next slide. A little bit about the background. Social determinants of health, or SDOH, refers to all non-medical factors that play into an individual's health outcomes. As we know, community pharmacists and pharmacies in the United States play a major role in public health and have opportunities to address disparities in healthcare delivery. Their close location to at-risk groups, including individuals in rural areas or those with lower socioeconomic status, and their strong relationship with patients make these pharmacies ideal locations for patient-centered services. As healthcare moves towards a whole person care, community pharmacies are integrating sustainable SDOH screening and referral programs addressing both clinical and health-related social needs, thus promoting better health outcomes for all. These programs bridge the clinical care with community-based social services, offering a sustainable model to improve patient outcomes while addressing health-related social needs. Therefore, the objective of this project is to develop a cost-benefit analysis within an ongoing social determinant of health screening and referral program in a clinically integrated community pharmacy now. Next slide. Looking at the study design, down below is the health-related social needs program timeline. SDOH is supported by a grant administered by the Quality Improvement Network Island and Peer Review Organization, IPRO, with funding from CMS. On the left, you can see a visual of the program reach across New York State based on the urban and rural status. The cost-benefit analysis was developed using the profit framework, and a time-driven activity-based costing was used for determining the intervention cost. Next slide. The cost breakdown of implementation of this program is shown here on the left. The fixed cost includes pre-implementation, personal training, fixed training, leadership team, and referral system. The variable cost includes the intervention and the referral system monthly payment. The benefits are broken on the right and is broken down into referral/resolution rates, the benefits for screening, stemming from Medicaid, the ICAR grant, and value-based payment. The benefits per resolution had an estimated $5,373, and this benefits per resolution was calculated based on literature. Next slide. Looking at the results, there were just over 1,000 screenings, with 50% of it having a referral and 134 with a resolution. The total program cost is just over $100,000, with a total calculated benefit of $720,000. This shows a benefit to cost ratio of 7.01 and a return on investment just over 600%. On the left here, you can see the break-even analysis showing screenings needed to cover costs at different reimbursement rates, with the value-based payment having the quickest break-even at just over 2,500 screenings, followed by the grant and then Medicaid. Next slide, please. Sensitivity analysis on the return on investment was also done. 27 scenarios were analyzed, which included a variation based on the referral/resolution rate, cost, and saving calculation methods. First, it was broken down into 3 different referral/resolution rates: the baseline, the best case, and the worst case scenario. It was then broken down further based on the cost of the program, which is the baseline, and then plus or minus 25% of the cost. Lastly, it was broken down by benefits, which includes actual study, the weighted average, and the adjusted administrative size value. The substantial BCR and the ROI highlighted the economic feasibility and the positive impact of SDOH screening in community pharmacies. The break-even analysis demonstrates how the program reaches financial sustainability at various reimbursement rates based on the different sources. And a sensitivity analysis on the ROI across baseline, best case, and worst case examined the impact of varying referrals and resolution rate, as well as the cost and saving methods, which observed an ROI ranging from 3.12 to 17.84. Next slide, please. In conclusion, social determinants of health screening and referral programs implemented in community pharmacies show a positive economic outcome, highlighting the potential for integrating social determinants of health into clinical pharmacy services. Next slide, please. Before wrapping up, I just want to say thank you to my co-authors who helped contribute to this research, including Francesco and Macy. Additional thank you to Dr. Daly, Dr. Chen, Dr. Iqbal, and Dr. Jacobs for your mentorship and help as well.
Thank you, Shelby. That was a great overview of your research, and really interesting research too, especially how it can provide additional insights into social determinants of health and how we can help patients through that within the managed care community. So thank you. So if we think back to the original part of our discussion today and some of the first slides we went through, we referenced the research agenda and the 4 pillars. If you wouldn't mind, take us through which pillar your research aligns to and a little bit about why.
Yeah, of course. Out of the 4 pillars, this research likely falls under the first pillar of real-world evidence to inform managed care pharmacy decision-making. My research has shown how community pharmacies are able to address disparities in healthcare delivery through SDOH screenings done at these pharmacies. Their interventions could identify patients' health-related social needs early on, therefore leading to more holistic strategies to improve population health. The results of the project show that it is economically feasible for both community pharmacy owners and payers to implement these SDOH programs.
Great. Thanks, Shelby. You hit it right on the head there with that one. That was a great overview of why it's real-world evidence. Thank you. So to learn a little bit more about you and the research that you conducted, I just have a couple questions if you don't mind. The first one is, why did you focus on this particular research, or what part of this research was of interest to you that led you down this path of this particular topic?
So I have learned a lot about health equity at school over the past years and have seen a lot of research that has been done on the importance of addressing SDOH factors and how they greatly affect patient health outcomes. So I was just interested to get involved and see if there's a way on how these programs are implemented itself and if it shows any positive economic outcomes.
So as you kind of think about that too, I think anytime anyone goes through research, there's not a straight line usually to get through all the research. There's things you learn along the way and kind of help you frame your experience and stuff through that. So if you kind of look back at the process you took and the research you did, what was one thing that you learned through that process doing the research that you did?
Yeah. So from this experience, I've just learned and really seen the importance of collaboration. This program had not only the help of the multiple people on the team, but also multiple pharmacies across the entire New York State. So it is highlighting the importance to learn how to work effectively with others and sharing these responsibilities and integrate diverse viewpoints. So working together allow these ideas and these new innovative outcomes to come about and thus advancing pharmacy practice.
Great. So I'm sure there's some piece of advice maybe that were given to you as you got into this. If you were on the giving side of that, then as you kind of think back, not only just in the process, but any advice you would give to those that are looking to get into doing research, whether they're students like yourself, new graduates, soon to graduate, or those that have been in the field for a while?
Yeah, so I would just say jump right in. Don't be afraid to talk to people who are involved in a research project with a topic that you're interested in. I actually got involved with this project was because I was reaching out to different faculty members at my school and seeing what they're currently working on and what interested me the most.
Great. Shelby, thanks again for joining us today. It was really great to get to know you and your research. Next
Thank you,
slide,
Jeff.
please. Yeah, thank you. So I want to thank everyone for listening. And if you're interested in more information on the AMCP Foundation Best Poster Competition, the Joint Research Committee, or poster presentation resources, feel free to visit the AMCP Foundation website. And some of those links are listed on the slide in front of you. Next slide, please. And then finally, a new AMCP Collaborate community is now live. So the managed care the managed care research community is designed to facilitate the exchange of ideas and information and encourage in-depth discussions related to managed care research. So join today and engage in innovative and thought-provoking research discussions. Next slide, please. Again, I want to thank our Best Poster Competition funding partner, Artia Solutions, for their support of the Best Poster Competition. Thanks everyone for joining, and Shelby, thanks again for joining us today. Have a great day.